Hello guys, welcome back to the channel. It's Unit 7 Part D. Infections during pregnancy. There are lots of infections which affects the pregnancy and lead to abortion. To avoid that, there are lots of precautionary measures which are taken in the form of monthly checkups. If you see a pregnant woman will go for hospital regularly for routine checkups. In these checkups, we will make sure the baby is healthy, it is growing in a healthy way, there is no any complications that affects the pregnancy. In that one thing, infection is very important. Infection can be seen in a pregnancy in three ways. First, inside the uterus in the form of intrauterine fetal damage, and it is also known as congenital infection. And next, in neonatal period, that is prenatal infection or sexually transmitted disease. And the infection, anything can be transmitted to the fetus from the mother activities. These are the three ways in which pregnancy can be affected in the form of infection. In these three classifications of infection, sexually transmitted infection is very important. Come, let's know what is pregnancy with AIDS. AIDS is caused by an HIV virus, that is human immunodeficiency virus. And how it is caused, there are various ways. If you share the needle with the HIV patient, like if you use the needle used by the HIV patient, you will get AIDS. Any blood transfusion from the HIV patient, having multiple sex partners, and from a mother to baby in the form of placental blood, the HIV can be transmitted. We need to stop HIV in these many ways. In a person, it can be seen in 4 stages. At very beginning, an acute infection can be seen, and after that, infection is present, but it is asymptomatic. In the sense, any symptoms related to HIV cannot be detected, and then this HIV attacks a particular region, and next, this HIV gets a partner of underlying disease, like any neurological disease or any secondary infections. Any kind of partner disease will be found. The diagnosis of HIV is generally done in ELSA test. Apart from this, there are 2 other ways in which HIV can be found. One is viral culture and other is viral DNA and RNA pattern detecting method. In these 3 tests, you can find the presence of HIV in a patient. Management of HIV infected pregnant women. As soon as we get to know the mother has HIV, if the baby is less than 22 weeks, we will advise the mother to undergo abortion. If she is not ready for that or the baby is more than 22 weeks, then we will take few precautionary measures. First, we will perform a test called CD4 cell count. CD4 cell count. In this, if the cell count is more than 500, then the baby is able to grow on its own. It's growing well. So normal regular obstetric care can be provided. If the CD4 cell count is less than 500, then we will provide a therapy which is known as acetothiamidine, which is of 100 mg 5 times a day. Prophylaxis for pneumocystis carinii infection. Medications will be provided if the CD4 count is less than 200. These are the 3 things which is followed. First, if it is greater than 500, routine obstetrical care will be provided. If it is less than 500, then acetothiamidine will be provided. If it is less than 200, then prophylaxis for pneumocystis carinii infection medications will be provided. This is followed when the baby is inside the womb. At the time of delivery, we have few precautionary measures which has to be followed. First is the personal safety is very important. The person who is performing the delivery, that is the doctor and the staff nurses, everybody should have a protective barrier with them. That is wearing the sunglasses, wearing eyes glasses, gowns, double blouses to protect themselves from this disease. Apart from this, the handling of the instruments, mainly needles and those blood samples, amniotic fluid, body samples, everything will be infected. So if your body tissue is exposed to that blood molecules, then you may get infected. So you need to handle this in a very safety manner. After the birth of the baby, we need to sanitize the baby. At that time, we need to remove the secretion of nasopharyngeal and oropharyngeal. And after the delivery, we will make sure the mother is not feeding the baby. Through the breast milk, the HIV get transmitted to the baby. So breast milk and feeding the baby is completely no. This is how the management of HIV is done. Hypertension in pregnancy or pregnancy induced hypertension. What is the normal BP count? That is 120 by 80. More than this, that is 140 by 90 mmHg is considered to be hypertension. This hypertension during pregnancy can be classified in various ways, mainly based on the symptoms. For example, in first condition, if you see pregnancy induced hypertension, that is due to pre-eclampsia and eclampsia. Eclampsia is nothing but fits. Based on the episodes of fits, it is classified. And pre-eclampsia is based on the proteinuria level, it is classified. Next, chronic hypertension. This is directly based on vital signs, that is the BP, the blood pressure ranging from 140 by 90 and above, that is chronic hypertension. And if you see, the third is pre-eclampsia or eclampsia superimposed on chronic hypertension. That is, they will have pre-eclampsia or eclampsia with that chronic hypertension is also seen. That is, the BP level, the vital signs will be more than this, as well as there will be a frequency of episodes of fits can be seen in the patient, or either proteinuria can be seen in the patient. If not, then we have another type which is known as transient hypertension. That is, after the delivery in the postpartum period, within 10 or 12 days, this BP will automatically disappear. And the last, we have unclassified hypertension. That is, we don't know the reason of hypertension, but it occurs. Pathoetiology of hypertension. First, these are few other risk factors. If it's her first pregnancy, or she has already a history of hypertension, diabetes, obesity, autoimmune disorder, age extreme, that means the mother has age of around 35 or above, multiple gestation, genetic factors, any risk factor that is making the placental growth is poor or abnormal placenta, then that will lead to hypertension. Let's see in detail. These risk factors will affect the growth of cytotropoblastic layer, and this is present in the placenta. Placenta connects mother and the baby. They supply blood and supports the growth of the baby. The arteries of mothers which is connected to the placenta will be straight, but because of this risk factors, this arteries will get spiraled up, will get like that, it gets spiraled up. Since it's the way is not straight, the blood supply will get reduced, and that leads to placenta ischemia. And at this condition, because of not enough blood sent to the placenta, the layer which is present in the uterus, endothelium cell, gets injured. When there is no blood supply, automatically the cell damage occurs. If inside the womb there is a damage, then the mother sends its blood antibodies to cure it. If you see here, the mother's blood vascular level, artery level, blood supply, everything will get increased. If mother's bodies get to know that baby is not receiving enough amount of blood or baby is suffering, then automatically mother's body reacts and sends the enough amount of blood, enough amounts of antibodies. The load in the mother body gets increased. When there is heavy blood supply, then the load on the renal system will also get increased. But all of suddenly, if the load get increased, the renal system can't function as fast as that can. So it makes proteinuria to occur, and this is how hypertension is increased. When there is a heavy blood pressure, when there is an artery pressure increases, when there is increased vascular, then automatically hypertension occurs. This is how hypertension occurs. The diagnosis of hypertension is very simple, that is the vital signs BP evaluation. Apart from this, we will perform urine analysis and ask the details about the seizures episodes. It's because if you see in pre-eclampsia, we will come to know the proteinuria level is more, and eclampsia is nothing but the episodes of seizures. So if we get to know about the details of this, we can classify the hypertension and provide treatment based on that. Management of hypertension. If you see more than hypertension, the seizure is given the priority. First, we need to prevent these seizures, and it is performed by providing the magnesium sulfate solution. See, this is provided in two ways. One is 2 grams in 8 ml, and other is 4 grams in 12 ml. We give it by diluting in the diluted water. And if you see for hypertension, we provide calcium channel blockers. At any condition, we don't provide ACE inhibitors and diuretics. ACE inhibitors and diuretics both are contraindicated for fetus. It leads to fetal damage. Next management is done during the delivery of the baby. If the mother has lots of frequency of getting the eclampsia, getting the seizures, then the delivery will be performed in the C-section, or else we will try to perform it in the normal way. This is the management of hypertension. Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.